Well, I think any physician, any retina specialist is going to have a pretty easy time adapting to this because, again, the images are pretty intuitive. We all know the basic biology, the physiology, and the pathology of what's going on. I think what people are really going to be impressed about is what they can see now, because a lot of times what we thought was happening, we can actually see it, and I think that's really impressive and really exciting. So I think AngioPlex OCT angiography is going to provide a couple of key advantages for retina specialists. First of all, it's really easy to use. People who are familiar with SD-OCT and ZEISS OCTs are really going to find it very easy to adapt to this technology. I think the technicians and the patients are not really going to notice much of a difference in how things work for them. And I think from a clinical standpoint, physicians are really going to be pleasantly surprised by having high-resolution images of vascular changes in their patients, because those are things that we really haven't been able to see in the past. And being able to see areas of non-perfusion in patients with diabetes, being able to see changes in the areas of macular ischemia in patients with retinal vein occlusion, and being able to see changes in choroidal neovascularization in patients with macular telangiectasia or age-related macular degeneration are just things we've only been able to see with fluorescein angiography before. And now that we can see them on a regular basis with OCT angiography, I think it's going to change the way that people look at those disease processes. And in terms of how we use it to manage patients on a day-to-day basis, I think first we're going to start correlating the changes we see and the images we get on the AngioPlex with what we see on fluorescein angiography. As we get more comfortable with the correlation or the differences between those two imaging methods, I think we'll learn to use the information from the AngioPlex in a targeted and kind of rational way to improve patient care, to guide our management, and also to hopefully save vision.